HERO has two arms, so it funds research, and currently it's funding research into the way we can better treat patients with blood cancer like leukemia, and it also funds nurse education.
Nurses are a key member of the haematology multidisciplinary team, and therefore are essential that they are upskilled in order to maintain patient care and expert care for these patients.
It has helped many of our specialist nurses to gain extra skills, and not all of their costs would be funded by the HSE, because some of the extra skills they do would be out of the ordinary. For example, some of our nurses have learned how to do bone marrow aspirates and trephines. This is a job normally done by doctors, and we find that when the nurses do it, the patients absolutely love it. The research that HERO is funding at the moment is about how we can better make leukemia cells die. One of the ways they die is called autophagy, and we're lucky to be working with Dr. Sharon McKenna in the Cork Cancer Research Centre. She's a world expert in autophagy. And in simple terms, autophagy is a mechanism that cells use to either die, or when you batter them with chemotherapy, they batten down the hatches and they can survive. But we've discovered the ways in which autophagy can be controlled, and one of the things you can do is make autophagy go in the direction of cells growing up and behaving themselves. So we call that differentiation. So instead of leukemia cells causing loads of damage and needing to be treated with really toxic chemotherapy, if we can manipulate autophagy, we may be able to treat leukemia, for example, with less toxic chemotherapy to the benefit of the patient.
I've been looking after these patients for a long time now. These side effects are devastating for patients. It involves prolonged isolation, separation from families, from their children. Ger Loughnane, who supports HERO, has been quoted as saying it's savage to the body and to the person, and it certainly is. They find it very difficult to tolerate. It's very devastating for them.
The research that we're doing at the moment is in collaboration with a number of international collaborators, chiefly our colleagues in Weill Cornell University in New York. And we have a HERO fellow. Her research is showing that very simple and non-toxic drugs such as sodium valproate, which is an anti-epileptic drug with very few side effects, can be used to help to manipulate the leukemia cell into a process of differentiation using the autophagy cell machinery.
It's essential that that nurse has the specialist knowledge to look after these patients, so that when that patient picks up the phone, they'll get the right answer, or they'll be referred to the right person, or they'll have a relationship with a consultant that they can refer back to their consultant, so that these patients are cared for lifelong, and that's really important that the nurses have the skills to do that.
So what's needed now is the funding to continue this fellowship, and the funding to harness the enthusiasm and skills of our nurses to continue to upskill as we get busier and busier and try and treat more and more patients.